Joanne, a staggering number of people have lost their jobs. The government has responded to that and put programs in place, but there are a lot of other groups in our society that are in desperate need. Can you shed some light on what is happening?
Sure, Kim, and thanks for having me. Mental health agencies have really feeling the brunt of this. CAMH, Kids Helpline, there's a surge in demand for their services. There's a lot of stress that's being caused as a result of this pandemic. Homeless people have nowhere to go. They maybe would have gone to libraries. They maybe would have gone to community centers. They've been shut down. Shelters don't have the proper physical distancing, and so that's a real problem for them. Women suffering violence, assaulted women, their abusers, they're locked in their homes with their abusers, so that's making it a lot worse for them, and obviously isolated seniors. They're at home, they're by themselves, they need food, and they need companionship. It's really tough on a lot of different people.
And the hard part about this, of course, is that the sector that usually helps these people, the charitable sector, is also getting hit very hard right now.
Yes.
So can you tell us why, what's happening there?
Well, first of all, the spring is a season for a lot of different fundraising events. And of course, because of physical distancing protocols, those events have all been canceled. And so charities rely on revenue from those events in order to support their mission. So that's a problem. People are not going to attend. They're not going to bid at silent auctions, and it's creating a really drop in fundraising. We've seen a lot of charities now start to lay off people. They simply cannot operate. Even art galleries, museums, they would depend on admissions. They would depend on revenue from their shops and from their restaurants and exhibits. That, of course, has all been shut down. So it's a really, really big stress on the charitable sector in general.
People I know want to help, and a lot of people just aren't sure exactly how to go about it. How would someone navigate where to start and which charities are impacted, in terms of to be the most effective as soon as possible?
Yeah. So I would start with food banks, your local food bank. There's a lot of food insecurity out there, and a lot of people have lost their jobs, and even with the government supplement, they still can't make ends meet. Your local United Way is a terrific place to start also. All United Ways and community foundations have set up COVID-19 funds, and they will help people that are most vulnerable in the community. So that's a great place to start also. CanadaHelps.org is a national organization, and they basically have set up a fund, and they've identified a number of charities across the country, social services as well as healthcare, that are doing work on this crisis. So those are great starting points.
What about crowdfunding? I've seen a lot of crowdfunding happening on social media.
So it's a great way to reach a lot of people really quickly. But what you have to understand is you don't get a donation receipt. You don't get a tax receipt for crowdfunding. So there's no transparency. There's no oversight. Whereas if you give directly to a charity, there are rules that charities have to follow. There's CRA, who is the watchdog. However, when you really need to appeal to a lot of people, and maybe it's not considered charitable from CRA's standpoint, it can be effective. So for example, I just saw on a crowdfunding site a restaurant fund, and you can donate to it, and restaurants will provide delicious meals to frontline workers. So it's actually, it gives you two benefits. It's helping these struggling restaurants do business, and it's feeding our overworked healthcare workers, frontline workers.
That's a great idea. Now, I know you've done a lot of work, and we've talked about in the past about people setting up donor-advised funds. Mm-hmm. Tell me a bit what you're seeing and how that's coming into play in this environment right now.
So they're in the perfect position to help, because they set up the fund in good times. They either sold a business and they wanted to mitigate the tax on the sale, or they had a large capital gain on a stock, and that's when they set up the fund. So they've already given it away to charity. They've received their tax receipt. It's sitting in what is technically a charitable account, and they're in the perfect position to grant out to charities that are in need. So I'm constantly now working with the donors of Private Giving Foundation, our donor advised fund, to grant. It could be to a hospital foundation, it could be a women's shelter. We had one, we were able to assist getting money right over to Italy to help frontline workers at a hospital there. And it's food banks. And so we're really seeing the benefit of foundations and donor advised funds now because the funds are available to grant. Not too many people are adding to them, and not a lot of capital gains in stocks these days, but that'll return.
Let me ask you a final question. When you look on this, and we hope this doesn't happen again, but the reality is a lot of people predicting this is something that we could be seeing more of. So how do charities better prepare, or how do donors better prepare to think about what they need to do?
So good question. So I would say when this is behind us, and it will be behind us, consider setting up a donor advised fund or a foundation if you haven't, because then when a crisis arises, you actually have funds that are available to help. That's number one. Number two is a lot of donors put restrictions on donations that they make to charities. They want 100% of it to go to a particular project. You need to make some unrestricted donations to charities because that would allow them to set up reserve funds. And that's the problem right now is charities don't have adequate reserve funds to weather this storm. And if they were able to do that, they would be able to ride this out a lot better. And then I think the final thing I would just say is that charities really need to collaborate more and work together rather than compete with each other. We've just seen a great example in Toronto. Obviously, the libraries are shut down, but they've collaborated with the food banks. And now our libraries are actually being used with library staff who are, stocking food and assisting the food bank. And so I just think that the more that charities can work together and collaborate, the better it is for everybody.
Joanne, thanks so much. Be well. We'll talk to you soon.
Right. Thanks, Kim.